So we are waiting to start until we have quorum. So we're going to be hanging out here. And if anybody has any colleagues who might be able to join us today, that would be amazing. Otherwise, we just wanted to open up the space and to make sure that folks know that we don't want to start till we have a quorum. Till we have.
Rachel Lawrence is coming. She had a doctor's appointment, so she'll be about 20 minutes late.
Okay. Thank you, Danielle.
I'm resending a couple invitations right now for people that can't find them, so hopefully they'll be able to join soon. Almost, Sarah. No, we have a few people signing in right now. Let me double check, but I think we are right at quorum, and we do have a couple more people joining, so we can start.
Great. Good morning, everybody. It is 10:40 a.m. on Thursday, February 20th, and we are going to finish out our panel review meeting today. We have Washington County, where I made a note somewhere about where we stopped. Oh, I remember where I made my note about where we stopped when we were meeting earlier. And I just want to, I think Stanley's out sick today, but is Nicole Eigler here today?
Yes, I am.
Hey, Nicole, great. Just to flag for you when we do start, you're on deck with Recovery Works Northwest. And just to remind everybody, this is a required panel review meeting that discusses the many applications across the state for Measure 110 that are known or should be known as behavioral health resource networks and by use of the DTRSF, the Drug Treatment and Recovery Services Fund. So this should be our very last meeting. I want to thank everybody for your ongoing participation. It's been really important and amazing to have everybody keep showing up. So thank you so much for that. I will share that the Oversight and Accountability Council has completed all 35 counties, has made votes on those. And so we'll be meeting later today to take your recommendations for Washington County forward in their deliberations this afternoon. So we will be done with this request for grant application process. So thank you. Just to remind everybody before we begin to ensure that your comments in the discussion really focus on the application at hand and don't bring in any outside information because that can't be fact checked, and we want to make sure that we are just sticking to what the providers give us on their application, because that is our job today, is to review and discuss those applications. Carly, you want to start with attendance?
Amy, are you here? Dharma? Keisha? Morgan? Zeb, are you in yet? I know that he was trying to register again.
There he is.
There we go. Hi, Zeb. I have you marked down in attendance. Abby.
Here.
Ariana.
Here.
Anaim.
I'm here.
Dana.
I'm here.
Daniel.
Good morning, I'm here.
Good morning, Daniel. Danielle.
Here.
Drew. Elizabeth. Emily.
Here.
Evelyn. Grace. Gregory.
Here.
Greta.
Here.
Hannah.
Here.
John. Juliana.
Here.
June.
Here.
Kathy.
Here.
Kylie.
Here.
Kirsten. Liz.
Here.
Mark.
Here.
Maya.
Here.
Megan. Michelle. Nicole Corbin. Don't believe she's here. Nicole Egler.
Here.
Rachel. And
She'll be
Sam.
late.
Okay, thank you. And Sam is not here, right? Sarah Adelhart.
Here.
Sarah Hebner. Sean. Stanley is out. Tammy.
Here.
Tatiana. Tim.
Here, sorry.
We have quorum at 22.
Fantastic. Thanks for Kathy for being ahead of the game here, and reminder that Washington County Health and Human Services is the CMHP for Washington County. And I am going to get my slideshow going here oh, she went to sleep, waking up. And we're gonna pick up where we left off. We last discussed recovers. Oh my gosh, we last discussed Oregon Recovers on Tuesday, and we're gonna pick up with Recovery Works Northwest with Nicole. I want to do a quick call for conflicts. So I'm gonna share just our homepage here. Great. Please raise your hand and let me know. Am I sharing the right thing? Can you see the Washington County info? Great. Okay. If you have a potential or an actual conflict of interest with African Refugee Immigrant Organization, Allied Health Services, Tigard, Boulder Care Provider Group, Bridges to Change, CODA, Forest Grove Foundation, HIV Alliance, Ideal Option, Juntos Northwest, LifeWorks Northwest, Lutheran Community Services Northwest, Mental Health and Addiction Association of Oregon, Miracles Club, Mountain View Recovery, doing businesses, Knapp Street Recovery, Northwest Instituto Latino de Adicciones, Oregon Recovery Works Northwest, Sequoia Mental Health Service Solutions Group, the Fourth Dimension Recovery Center, the Alano Club of Portland, Transcending Hope, Virginia Garcia Memorial Health Center, Washington County Health and Human Services, and I'll just share in the early aughts I worked for Virginia Garcia. Any actual or potential conflicts of interest? Okay, any questions or comments about where our purpose and objective for coming back together for the very last time today? Okay, we're going to stick to our 5 questions. If you need me to post this in the chat again, just holler. Thank you in advance for our process and hopping right back in, Nicole. Go for it.
Okay, so for Recovery Works Northwest, here's about cultural specificity. Recovery Works Northwest services are available to adults in Oregon experiencing or recovering from substance use disorders. We partner with culturally and linguistically specific organizations to ensure culturally responsive care. So that's number 7. And then next, about the Medicaid billing. Yes, many of their SUD treatments are eligible for Medicaid reimbursement. However, their peer support activities, including those addressing those with corrections backgrounds, are not eligible for reimbursement. They bill insurance first and attempt to enroll clients into Medicaid before using M110 funds. The M110 funds will provide ancillary support to prevent programs from operating at a loss and having the risk of having to close their facilities. Grant funds will not support staff that provide reimbursable services. They say it's also especially important to have M110 funds to support their deflections program, because that's a historically stigmatized group and would otherwise not be possible to serve. Are their peers located in the field or office? It looks like both. Their peers are integrated into the SUD treatment at their office and also integrated into housing services and harm reduction, but not screening and assessment. They do mention a new housing facility for Washington County in this application, but they did not ask for funding for the housing, so there must be some other source for the funding for they say a new housing facility in Washington County. But what they are asking for funding is for staff for the housing. So that's why you'll see in their budget, it just asks for funding for peer support, not housing. And then the only harm reduction they give out is naloxone. So overall, I did like that this program has an emphasis on patients referred from corrections and has a deflections program. Okay, they also, one thing to note is that they asked for a van, a vehicle purchase in their budget, but it was not mentioned in any other part of their application. And they say the van will be to transport people from the housing facility to treatment. So yeah, any questions?
Thanks, Nicole. Appreciate it. Next up, we have Sequoia Mental Health Services. I see Mark here today. And do we have Mark, you are going to fly solo.
Okay. The answer to question number 7 is Sequoia provides culturally and linguistically specific treatment services to several communities, including Spanish-speaking, Iraqi-speaking, Chinese-speaking, and Farsi-speaking clients in Washington County. With previous grant funding, Sequoia hired a bilingual Spanish-speaking provider who is currently working on her CADC license. We plan to expand this role significantly with these grant funds. Hire 2 more culturally specific bilingual staff members and 2 more community-based staff members to work with our SPMI population. Additionally, we will be able to internally hire a peer support supervisor and add more treatment groups, curriculum, and geographical locations. While Sequoia is currently reflective of the populations of Washington County, with these funds, we hope to increase the diversity of our staff to better serve our large BIPOC populations. As far as Medicaid billing, yes. Sequoia Mental Health offers SUD treatment services that are eligible for Medicaid and other private health insurance reimbursement. Sequoia Mental Health does have the ability to bill Medicaid and other health insurance. Sequoia currently is contracted to provide behavioral health services for mental health recipients. Let me back that up. Sequoia currently is contracted to provide behavioral health services for Medicaid recipients through Care Oregon, HealthShine, Trillium, Providence, and MODA. And we have a contract with Washington County Behavioral Health to offer care to clients who qualify. These funding options will be explored prior to accessing Measure 110 funding to pay for services. Sequoia has a skilled billing department that will be able to file claims for reimbursement with any payer. Outreach services are generally not billable for Medicaid, and the burn funding would assist with expanding our outreach programs. They're offering both peer and harm reduction for their peer support on their narrative for how they're going to be spending the money. What they put there was program share of office utilities, electric, water waste removal, and janitorial. Program share of office telephone and internet connection. Program share of office janitorial. Program share of office supplies. Supply, cell phone, office equipment, IT support, and general liability insurance policies, laptop replacement, and 1 new laptop. So that is a portion of what they'll be doing the peer support money for. And then for harm reduction, harm reduction supplies includes Narcan, hygiene supplies, fentanyl test strips, wound care supplies, tents, sleeping bags, bus passes, bottled water, sack lunch supplies. Treatment incentives include food, coffee, and gift cards. And that's what they put on their
Thanks, Mark.
application.
Anybody have any comments or questions about Sequoia Mental Health Services application? Anything else you want to add, Mark?
I don't think so.
Okay. Right, Tammy? And
Okay,
so
on to solutions.
Mhm.
So started in 2018, our SUD outpatient clinic has been purpose-built to deliver services to the Latinx community. We are committed to developing and maintaining services that are culturally competent, consumer-guided, and community-based. Cultural competence is an essential requirement for our staff to provide effective services to our Latinx population. Our program has been built from the ground up to be culturally and linguistically specific. To all services are delivered by Latino counselors. Key principles that we believe in: ensure that clients receive from staff effective, understandable, and respectful care. Care is provided in a manner which a manner compatible with cultural health beliefs, practices, and Spanish. To recruit, retain, and promote at all levels of the organization a diverse staff. Ensure that staff receives ongoing education in culturally and linguistically appropriate service delivery. Make available client-related materials and post signage in Spanish. Develop participatory collaborative partnerships with Latinx communities. Ensure that conflict and grievance resolution process can identify, prevent, and resolve cross-cultural conflicts or complaints. So Medicaid and billing, the answer to both parts of the questions is yes. They are an Oregon Health Authority, or OHA, approved culturally and linguistically specific services, or CLSS, integrated co-occurring disorder and DUI services provider. We are Oregon Health Plan enrolled provider and can bill DMAP directly for members not part of the CCOs. And it goes on to talk about they're contracted with Health Share of Oregon, Trillium Community Health Plan, and Yamhill Community Care CCOs. Let's see, their peers are in the field or in the office. They are both. And peers integrated into the services. They are only applying, I believe, for assessments and peer support.
Great, nice summary. Anything else you'd like to add, Tammy, or does anybody have any questions for her? Okay, thanks, Tammy. Next up, we need some Measure 110 support for the Fourth Dimension Recovery Centers application.
I can read question 7. 4D believes adolescents and young adults fit the definition of culturally and linguistically specific services. As such, it has developed an age-specific peer best practices manual that supports adolescents with tailored programming.
Thank you. And they are applying for peers, housing and harm reduction. Can you tell if the peers are in office in the field or in the field? Kind of housing, are they doing their own housing? And what's their harm reduction menu?
Their peer counseling and support. They have a drop-in center and its focused service activities on various mutual aid meetings. They also are expanding the adolescent family center expansion. They also have listed on here some street outreach that they're going to be doing with harm reduction. They also have a deflection team expansion. 4D will have 2 peers connected to deflection and criminal justice reduction efforts. 4D works closely with community partners, including public safety, probation, and court systems. This team will focus on reducing criminal justice and interventions and supporting clients with recovery to avoid jail, increasing service engagement. Their harm reduction. 4D will continue providing overdose reversal training and Narcan distribution into all aspects of our programming and report the total units distributed. They don't have much else. Their housing is going to be transitional housing for young adults of any gender, with OHSU gap analysis reported that Oregon needed an additional 3,000 plus recovery housing. So on their budget, they have a robust budget of directors and peer outreach workers. They also have a deflection supervisor and a deflection peer support. And that is approximately $978,000. They've gone into specifics. Their harm reduction supplies. is Narcan, HIV test, STI tests, and syringes, etc.
Thanks, Kathy. Anybody have any questions or have anything else you want to add? Morgan. You're still on mute.
Am I now? I think can you hear me?
Gotcha.
Okay. Sorry, I'm not feeling super well. I probably won't make the whole meeting. I just want to make sure after just hearing it right now, if I'm not here, can someone note where there's the deflection ads like that? Like they're hiring, that application included multiple FTE for deflection positions, which we discussed yesterday is probably not being something we want to fund. So I'm gonna make my little note for that, and that's all.
Yeah, that was 1 deflection supervisor and 3 deflection peer support. And that was 744. I had too much highlighted the last time. So it's 744,673. I'm making a note of that for you, Mark.
Thank you.
Any other questions, comments? Okay, June, you're up. Alana Club.
Yeah, so they put in A for number 7, and this organization plans to do peer support and harm reduction. They have 2 programs. One's called Peer Connect and one's called their Recovery Jam. Both are they're peer-based programs. They do peer services in the community. They're not able to bill. They do not bill Medicaid or insurance. Their harm reduction, this is what they say for harm reduction. M1 tending for Project Red will increase the availability and accessibility of overdose prevention supplies, education, and trainings. Alano will distribute naloxone, fentanyl, and xylazine test strips, syringes, and wound care supplies to anyone who needs them, including individuals, mutual aid, and community-based organizations, businesses, and emergency responders. I don't know if there's anything else. They are in the community. They have brick and mortar, and they also do community outreach.
I'm sorry, June, did you touch on their harm reduction?
Yeah, they have a full harm reduction program.
Got it. Right. Any questions? All right. Next up is Transcending Hope, which is Kathy, and I'm not sure Dana is here.
Yeah,
You are here. Great. Hi, Dana.
I'm here.
Yeah.
I'm happy to
Awesome.
provide
Thank you.
information. So Transcending Hope, their question for number 7 answer is over 30% of the community we serve at Transcending Hope identify as Latinx community members. We employ a dedicated team with a Latinx background to ensure our programming is culturally and linguistically specific. This team includes 7 house managers, 2 housing navigators, 2 case managers, a supervisor, and a program manager. Our team is instrumental in providing support to residents and ensuring that services are delivered in a culturally sensitive manner that reflects the community's diverse experiences. 2 of our 6 homes are specifically tailored to cater to the needs of the Latinx men and women. These homes are meticulously designed to provide culturally and linguistically appropriate services, ensuring that residents feel heard, respected, and supported in ways that resonate with their cultural identities. The organization has extensive experience in providing culturally responsive housing. In cases where residents require additional support beyond what is offered, we have established a system to connect them with community supports who can provide peer services and culturally sensitive care, ensuring that everyone receives the appropriate assistance. Transcending Hope is under the leadership of Dina Feltz, the executive director. Dina identifies as a person with lived experience in long-term recovery and a biracial Latina woman. She has firsthand experience navigating complex systems related to mental health while supporting her son, who is dealing with co-occurring schizophrenia and substance use disorder. With her personal and professional experience as a peer mentor, Dina brings valuable knowledge to the project that is crucial to its vision and understanding the population it serves. Regarding Medicaid billing, Hope is currently unable to accept Medicaid or health insurance billing purposes, as housing is not a billable service. So the housing that they are offering, the program offers low barrier stabilization housing, providing live-in staff support, including supportive meeting, focused on goal setting and community building. Transcending Hope provides a housing navigator case manager to collaborate with participants and community-based organizations in and outside of a burn. They provide wraparound services and supports to ensure stable foundation and transition from for the participants. These programs will be able to serve about it says 80 individuals annually in the 2 locations.
The concern I had with this is the fact that they have to lease these homes. So that is not something that they have, and I don't know if that falls underneath the no capital. So most of the funds include the lease, all utilities, internet, computer, general house supplies, stuff that you would expect in there. It also has some Narcan and flex funds for supporting community building activities, deposits, phones, storage, food, birth certificates, ID, clothing, etc. So that was my only concern, is that there was $878,000 for housing facilities through leasing, and they have not leased them. So I don't know if that's considered capital.
Thank you. Any other discussion or questions? Okay. Second to last is Virginia Garcia Memorial Health Center. It looks like that's Juliana and Danielle Garcia.
Yeah, hi, I'm here. So Virginia Garcia Memorial Health Center, for answer 7, they say excuse me, our culturally and linguistically specific services are designed for the Latina and Hispanic community, a significant portion of our patient population. We have bilingual medical staff fluent in English and Spanish, and offer interpretation services for other languages to ensure effective communication. Health education materials are culturally relevant, and our outreach programs engage the community through local events and centers. We provide behavioral health services, including counseling and group classes in Spanish, and patient navigators assist with healthcare systems navigation in Spanish. Continuous cultural competence training for our staff ensures respectful and effective care, fostering an inclusive environment where all patients feel understood and valued. As far as the Medicaid question, they say Virginia Garcia Memorial Health Center is an authorized provider for Medicaid, Medicare, and most commercial insurance plans. Additionally, we are committed to serving all members, including those who are uninsured or unable to pay. They plan to utilize the grant funds to enhance and complement services provided under Measure 110, ensuring no duplication or replacement of those services. Their strategy plan includes several initiatives aimed at expanding their offerings without supplanting Measure 110 services. The peers, my interpretation is that their peers are in the office. They say that they employ certified peer support specialists who provide ongoing emotional and practical support to individuals in recovery. These specialists, who have lived experience with substance use disorders, offer a unique perspective and foster a sense of community and belonging among their patients. Additionally, they facilitate peer-led support groups where individuals can share their experiences, receive ongoing encouragement, and obtain constructive support in navigating resources in the recovery process. They seem to integrate providing services that minimize the negative consequences associated with substance use. Our on-site and mobile units reach underserved areas, offering harm reduction supplies, health screenings, and referrals to treatment and social care resources. Our harm reduction initiatives include training and distribution of naloxone kits, distribution of fentanyl testing strips, support groups that provide safe space to share experiences, as well as access to resources, and educational workshops on substance use prevention, overdose prevention, and safer use practices. Any type of housing offered in the application. I don't know if Julian has more.
I think you did a good job covering it. Danielle, I couldn't tell if their peer services are integrated into that they do, but I did see that the harm reduction is a mobile unit. And it didn't say who would be delivering that service, but typically that's peers. I don't know if you.
Now that you say that, that makes sense about the harm reduction. I had it in office, but yes, you're right. It's for both office and outside, but yes, to the other part.
Any questions from anybody about this application?
I have a question.
Yeah, go ahead, Zach.
I'm sorry, I had to take a phone call real quick, so I missed a little bit. But I noticed overall, like the SUD applicants applied for less money overall, so I'm kind of keeping even balance between the services. So I'm asking about this program's SUD program because they put $12 in their budget. I was hoping you guys can tell me what they're doing for the SUD and like if they have something in their budget besides $12.
Yeah. Also wanted to know they didn't apply for housing, but it looks like we've got an orange square with $12 in it under housing, but they didn't indicate that they'd be doing housing on their application, just FYI. And then I can pull up their SUD description too. Is that what you're looking for?
Even looking at the budget workbook, like the milestone tab, or even like the top section of the budget area should be able to identify how many people they hope to serve. I think Zeb's, I'm guessing he's asking also about like impact, like how much of a said program that looking to serve.
It's mostly staff, a lot of CADCs, QMHPs, and certified recovery mentors. Like some of the other applications, most of these costs are going into the program costs for staffing. And so it's basically salary and fringe benefits make up the majority of that. There's like some laptop and related supplies that could be for some of the other programming though, like the peers and the harm reduction. They do have MAT as well, so they didn't say anything about MAT providers, hiring MAT providers, but they do have MAT services under their SUD programming.
So on the milestone section of the budget workbook, does it indicate how many people they plan to serve?
Yeah, for said 420
A year or total over the 4 years?
for it says it has it broken down per year. So for 25 to 26, they have 420. They have that 420 for the next year. Yeah, they just have 420 for both of these years, unless Danielle is seeing anything different.
Does that help answer, Sam?
Yeah, and maybe does it state how many CDCs that they plan to staff?
Yes. For substance use, so they have care coordination manager. All of these are at a half FTE. So substance use and care coordination manager, referral manager, 1, 2, 3, 4, 5 CADCs. Oh yeah, and there's a clinical pharmacist. So I imagine that would be for the MAT treatment. And that's also a half FTE. They also have recovery mentors. Again, this isn't broken up by whether it's for the this is all in the programming costs, but the recovery mentors are either for the peers or the substance use treatment or the harm reduction.
All right, thank you very much. That answers my questions.
Yeah, no
Appreciate it.
problem.
Great. So I did a thing where I looked at the last 2 reviewers for Washington County Health and Human Services, and I thought, great, I got it. These 2 people will take us home, and they're both here today. And I closed it, and now I can't find it, and I don't remember.
It's me and someone else. I don't know
And
who
me.
else.
Yeah,
There we go.
Gina, Danielle, thank you. Take us home with Washington County Health and Human Services, please.
Danielle, did you want to read 7? I can read 7. I have it up.
Yeah, I have it up.
Okay, go ahead.
It says HHS provides services through an equity approach. We work to bridge the gap historically excluded and underserved communities, including Black, Latine, Native American, Asian, and Pacific Islander communities and other people/communities of color experiencing and accessing harm reduction services and information and education. We provide culturally and linguistically specific and responsive services. We focus on hiring bilingual and bicultural staff as it is meaningful that our workforce reflects the population we serve. More, we can provide them with professional development opportunities. There are partnerships with culturally specific organizations such as Centro Cultural. We conduct outreaches to communities of color and serve communities who have historically mistrusted government entities. These partnerships enable us to better provide culturally and linguistically specific and responsive services. To date, 29% of our HIV/STI testing services have been provided to communities of color. Our burn coordinator also supports expanded culturally specific behavioral health services and created a culturally specific subcommittee that meets to discuss ways to better support our diverse communities' unique needs.
Great, and they are all in for harm reduction, where one of you recommended.
Yes.
I think I recommended. You didn't recommend, Danielle?
I didn't recommend,
Yeah,
and
yeah.
my notes reasoning here says that and scope responses were comprehensive as the intended harm reduction impacts of the work to be done by HHS. Most of the funding is allotted towards staffing in about 11 positions rather than materials and supplies for harm reduction, like medical supplies, tests. So the grant funding for staffing of a government agency at such a large request, to me, didn't feel like the best use of funding.
Yeah, and so I have to agree with you. I did approve because I felt that their harm reduction program, they're teaming with other providers that are doing syringe exchange, and they are going out with those agencies and doing a lot of STI testing on site and a lot of infectious disease, wound care, that type of stuff. But I do have to agree with Danielle. Their ask is almost all staffing, and I'm not sure that the staffing isn't reimbursable. Cost very little in supplies ask, but I did approve based on some of the programming that they were wanting to do out in the community when it came to infectious disease and data collection and analysis.
Any questions? Anybody?
Thank you both for the presentation.
Anything else before we move on? Okay, here we go. You know what's next. Okay, so Ariana, in her incredible ability to just jump in, is helping us see that the countywide formula on the top right is 29.1-ish million. And this is a starting point, starting point number one. All previously funded applicants, so existing grantees with the $5 million cap per applicant applied. And only the areas where both of the reviewers recommend. So that would take out Washington County Health and Human Services and Northwest Instituto Latino de Adicciones completely. And I think that it is a place to start if there's questions about program costs, kind of what that would mean. Anyway, but again, just a starting point. And I believe there's probably more. Here's number two. Actually, that's exactly what Ariana just did, is take out Northwest Instituto Latino and Washington County Health and Human Services. And with the cap and only existing burns, is there a third? Yes. And then adding an overlay of the highest rank, just in terms of the quality of the application based on the rubric that was developed. We would be looking at some existing and some new. Just recall that the OAC is prioritizing existing and culturally specific. Let me see if there's anything else. Here's just the difference. I'm going to leave this slide here while June takes the mic.
Yeah, I just wanted to say that I do agree with Danielle on the Washington County Health and Human Services. I felt that I could be wrong, but a lot of their staffing felt like it could be billable, and they do have the ability to bill. I wanted to also just make mention, I feel like it would be doing a huge disservice to Washington County if we did not include Northwest Instituto and their services. I think in part their application, they stated that they're the only ones in the state of Oregon that have a culturally led specific drop-in centers for the Latinx community. So I really think that might be a bad choice to exclude them.
If any or both of those reviewers, I'm sorry, I can't recall, are here today, and if you want to add anything, that would be a really nice addition to this discussion. And I'm gonna also stop screen sharing and have Ariana take over while Zeb takes the mic.
Yeah, I strongly agree with June there. I like to keep Northwest. I just lost the full name here, but I agree with what she just said. And also the unique population that the African Refugee Immigrant Organization also provides care to. I would like to see them added to any potential burn moving forward.
Hey, so let's see. What can we do here? I think what I can do.
Ariana, I'm gonna have Nicole say her comment while you're. Sure. No problem. Okay, Nicole, go ahead. Oh, we can't hear you. You're not on mute, but I can't hear you.
Hello, hello.
Yes, yes.
Okay, okay. About the housing program that I said, so I found a partnership in this set. So Recovery Works Northwest is providing the staff to run an IOP inside the housing that Transcending Hope is proposing. So I just want to point out that if you want to fund that $3 million housing that Transcending Hope wants to make, then we would have to pair it with Recovery Works. And it looks like Transcending Hope wants to make a new treatment housing program in Washington County for 16 to 20 people, one house for male, one house for female.
Kathy?
And Transcending Hope, that was for leases. And so there's still some details. Jason sent me a message on that, and I think leases are okay, but it all depends on if they're purchasing, or I'm not sure what our requirements are.
So that would require some digging. Amy.
Yeah, I know that we're not, this time around, they had decided we're not allowing for purchasing properties. So it would have to be a lease, and that would probably be in the contractual negotiations, wouldn't it, with OHA?
Well, I think an additional impact, Amy, is exactly what you're talking about, is the final award amount, and whether that is something that can be afforded with the amount of dollars we have to grant.
Yeah, it's hard not knowing for sure if they're aware or what they're, it sucks, but that's.
Yeah. So far on deck, what I'm hearing is existing providers, removing Washington County and adding, and keeping El Instituto Latino de Adicciones and adding African Refugee Immigrant Organization. Great. Oh, and there it is. Zeb, go ahead.
Yeah, I had a question about, so Transcending Hope, and then what was the other organization that they were partnering with?
Recovery Works Northwest.
So just so I understand, would Transcending Hope be leasing the housing and then the other place providing what, like peer services to the housing? Like what are they doing?
Yeah, Recovery Works would be providing the peer services for the housing and running an IOP, I guess, inside the housing. And then, yes, we need the person who reviewed Transcending Hope to say whether it was bought or leased, because mine doesn't say that.
All right. Thank you. Appreciate it.
Does someone have that application open to give it another read through? That might help.
For which one?
Transcending Hope. Morgan?
And then if the IOP is in the home, is it only there for the residents, or is it open to the public?
Okay, let me look.
They do say, Transcending says in their project scope, over the past 6 years, Transcending Hope has successfully established 5 aid and assist community restoration homes and 8 behavioral health recovery network homes, in addition to existing transitional homes. Both aid and assist and burn housing models are rooted in harm reduction and stabilization principles and are specifically designed for individuals experiencing substance use disorders and homelessness. It doesn't go into a lot of detail in here about if it's a lease to purchase or if it's just a lease.
And yes, the IOP is for residents only.
Okay. Any other questions before we start looking at, I think it's, yeah, proposal 2? Is that, Morgan, is that an old hand?
Oh,
Yep, it is. Okay, go ahead, Zed.
yeah, I was just hoping that we could scroll over on proposal 2, so I can see what's on the end, the right side. There we go.
The total is 33 million, and that puts us at 70%, that's 4 million over. But you added an org that is capped at 5 million. And it actually will be slightly more because these numbers will be added back in. But I think it was, Morgan, was it 4D that you had concerns about the monies being used for deflection? Is that correct?
Yeah, but if their budget has been reduced sufficiently, let's see, under this proposal.
At 70%, it would be 3.5 million.
Then yeah, that more than covers the deflection expenses. There just need to be a directive, essentially, that we would rather they didn't use our funds for that.
Oh.
And what was the total allotment for this county again?
29,157,000.
All right, 29 million. Okay. And could you go back to priority 2 again, or prop 2, where you're at? I'm
Sure.
sorry.
I'm just gonna do this. So we have it at the top.
All right, so I'm just kind of looking like we got a lot of peer support, which peer support's amazing, like I said before. And we need to get rid of $4 million roughly.
I have a question too, looking at really organizations that are asking for less than $1 million. Like, do you want these folks to be reduced by 30%, ideal option? Because they're asking for so little, just throwing that out there for consideration.
Yeah, we're a 4-year period. Thank you for that flag.
I would say no,
No.
but I don't know what my other council members think.
I agree with Zeb.
Morgan?
Although I do understand the concerns about not reducing organizations that have lower asks, then it is essentially treating them special than all of the rest of the organizations who are getting reductions. And I'm not sure if that is super fair, that just because they ask for less money, they'll be some of the only organizations in our batch to get a fully funded allocation. That we can't reduce them very much and still have it be viable when they're at the lower end there. But just because they didn't ask for very much doesn't enshrine them at 100% of their ask, I wouldn't think.
Did I remove that reduction? Deb, Amy?
Well, I totally respect Morgan and I agree with her 99.999% of the time. I think we just have a difference of opinion on this one. So
Yeah, but I don't care that much, so just go with what Zeb wants.
I'll leave it in.
I'm gonna stick with where I was at with that. I think that, just because, I feel more comfortable with the way that Zeb and I were talking about, only because they are small. The smaller entities asking the smaller asks are, we still need them to fill the burn. So we don't want to, it can greatly impact a smaller organization more than it will the larger organizations. And that's why we need to kind of sometimes make those decisions.
What else, y'all? I mean, we could start to take this down percentages across the board. You could still kind of look specifically, Zeb mentioned peer support with a which is great, but also not enough money to go around. You could look at the size of the organization, number of people they're hoping to serve. How else do you want to look at this potential burn recommendation to the OAC to get it a little closer to, maybe $3 million closer?
we'll just throwing something out there. What if we could reduce all by a couple percent or 3% or whatever the percent would be needed to take it. My math's way off, but to the allotment amount overall. I guess my only concern is with SUD is already low. And so I don't really want to take away from the organizations that are providing the SUD because it's already such a low amount. And if there's another category that relates to as well, then I don't know if anybody else has thoughts or what they think about that.
I'm sorry, the bad news is that I neglected to add the 70%. And so that adds to this total of the 70% cut, which makes us 5 million over now. So here's a proposed algorithm, taking this down to 65% reduction for everyone except ideal option.
Yeah, let's try that, see what it looks like.
Or algorithm 2, take down every organization that isn't offering SUD by 65% to 65%, since SUD is so thin.
I like that better, actually.
And Virginia Garcia applied, correct? So, oops. So they should be left in there? Question mark. They applied for SUD.
Deb is nodding. Yeah, they had CADCs in their budget.
Okay. I just want to make sure this is entirely correct. All right.
Zeb and Amy, when I was on my phone, audibly they were like, "But what about the orgs under a million? Should we reduce those?" And y'all were like, "No, because if it's too low, we can't." And in my head, I'm like, "Wait, are we talking about orgs that are 1,900,000?" And like now I see it on my computer, it's 282,000 for 4 years. I was like, "Well, duh."
Yeah.
Makes a lot. Excuse me, makes a lot more sense now.
I'm sorry, I realize this is a little bit slow, but I have learned that it's best to be methodical with data.
Take 50% longer to not have to do it twice. That's still faster.
Indeed.
Measure twice, cut once.
There it is.
Okay, so now we are closer. But it's still not there. Maybe close enough to pass it on.
32 million.
Yeah, because my idea next was like kind of looking at organizations' ability to bill out Medicaid and potentially other funding sources. But I would be comfortable passing this on to the council. We're going to meet this afternoon. We could take that up there. I'm not sure how everybody's feeling, or how Morgan or Amy, what you guys think about that.
I agree. I think we should move it on to the council so that we can do our thing there.
I do agree with your comment earlier, Zeb, that there seems to be an uneven distribution of service area in this particular county just based on the entities that we've chosen. There seems to be a lot of peer support and less in other areas. So that's my only concern with this one.
And I'll definitely bring it up in the OAC council meeting as well. Thank you. Thank you.
Morgan.
I won't be able to make the OAC meeting later. So just with like this level of imbalance, I would probably like to see us like hold back an additional percentage, maybe like put everyone down from wherever it's at now to like 60 or 55 or even further, and like have the little sheltered pot of money and then be like, who wants to do more SUD? We have this money for you. Because that's not going to be a good like continuum of care there. That's really going to interrupt people's progress through the services in a way that is inefficient and just simply isn't going to get people the recovery supports that they need. So rather than making the organizations happy by funding them for what they've wanted to do in peer support. I would rather disappoint some of the organizations to make sure that the people can actually get the full spectrum of services they need.
Deb?
Also great points, Morgan. And maybe we could just do that here real quick if we could. The only thing is when I'm looking at all the applicants, if I'm looking at the right form here, there's only 2 providers that didn't get moved forward that provide SUD services, and that was Allied Health Services and Boulder Care. It looks like everybody that put in for the SUD, I believe, are getting their full ask in that area. Now, somebody could correct me if I'm wrong.
That's correct.
So the options would be to either talk to the providers that are approved in negotiation that have them bump up the services, or bring in 1 or 2 of those other providers right now. And I guess we could, if we can get the percentage down, like Morgan was saying, then we could just decide between those 2 organizations if we want to divvy that up, or what we want to do with that, if that's the route we want to go.
Morgan, go ahead.
Yeah, I mean, that's the $1 million question. I think it would be whether or not I would maybe want to pull in Allied here just to see, or we can just do the percentage thing where you chop an additional 10% off, right, Zeb? And then just go to the OAC and say, hey, there's this $3 million. Do you want to go to the approved providers right now on this list and ask them to increase their SUD offerings? Or do you want to bring on these other 2 SUD providers or some hybrid thereof? And doing that through an additional 10% proportional reduction across the board. And then taking whatever that is, should be about 3.5 million into a little SUD slush fund.
No, it's definitely a great idea. Just right now, we're at 34,000 or 34 million. And so we still got to get to the 29, right?
Oh, I forgot that part. Thanks.
But yeah, no, it's a great idea for sure.
Let's see. So you have 25 million for peer support. That's 5 times roughly, well, what, 4 times housing and 5 times SUD.
Can we take 5 million off that some way? I'm not sure how that would math, but
The only thing, I apologize, LifeWorks, but this is the only agency that's only doing peer support.
no, I just noticed that too. And if you take that off, then they're not tied to another service area. So maybe we should take them off
Yeah.
to help lower that number.
So that gets us down to 33 million.
What else? Other thoughts? Nicole or Morgan, is that an old hand? Yeah, I think so. Nicole, go ahead.
As long as this is this might not be consistent with our process, but we see the two highest peer support costs are with Northwest Instituto Latino and Fourth Dimension. If we could even specifically cut them a little bit more, that could bring us down.
Yes, that is. Let's try
I guess
that.
that might not be fair
Well, if
to
we're
cut
gonna,
them a higher percentage than everyone else.
well, there's
Like
been
total.
precedent set in other counties where places have gotten cut as low as 25%.
Morgan?
Can I request the box that's the percent of the total NTE?
Yep. 1 second.
Thank you.
You know, I think, you know, the OAC members have just done a beautiful job at the end of the heartbreaking, you know, decisions, just articulating that there's a clear need for these funds to do good work in the community, and there really just isn't enough to go around. And that all of these decisions are awful, right? So none of this feels good. And I think what I really appreciate about these conversations is really looking at the whole continuum, the burn continuum as a whole picture, like looking at it holistically and identifying, you know, said treatment is really, really important, right? You know, that's a major, well, it's a sixth of a component of a burn, and making sure there is a balance and enough equity to feel like a burn is not, you know, overweighted in some areas and under in others. So I appreciated that. And, you know, we do really want to work with our counties as individuals, right? Because, you know, the geography of and the culture of Oregon and its counties vary really wildly. So I appreciate this conversation. All right, Morgan, you got your percentages. They're real small, but they're there.
Thank you.
And down to 33.5.
Oh, those numbers aren't right.
I'm sorry, Rich.
Percent of total request. There's just, I mean, it's possible. There's that they're all 65% in a row like that from their initial
Because this is a 65% reduction as requested.
but then the cap and the program cost didn't hit them first.
That is the cap. Is that what you meant? So that's 65% of 5 million.
And 5 million is
Is
their initial ask?
No, that's their cap.
Okay, so the percent
Oh,
of
I see what you're saying. Okay.
yeah, okay.
It's the percent of the total request, not the percent of their reduced, not even a request amount. Yeah. Emily, you had your hand up. You don't need to unmute and weigh in. I just wanted to give you space if you have anything to add. All right, so we'll get these right. But the column N, it's like it's still the last, most recent one. Any other thoughts or suggestions?
You know, somebody brought up the show Black Mirror the other day, and everybody is familiar with it. It's kind of like Twilight Zone. but I feel like no matter what we do, we're always going to get to $33 million.
Oh, Morgan?
Oh, yeah, let's maybe take a special look at the ones who have $5 million in the J total box that are still the highest of the asks. Let's throw Lutheran Community Services Northwest in there too, since they're just a hair under that. And could we look at maybe a reduction for Forest Grove Foundation, HIV Alliance? Let's maybe skip Lutheran actually, because they're doing SUD. And the Instituto. Or I guess we already did that, right? We already went to those two at the bottom. I don't know. What is the percentage if we just get down to what we need? What are people getting? 62%? Where are we at now?
65.
65, and we're at 33, so like 10% over. So actually that's actually a lot, I guess, right? It'd have to be like 55 to get down there.
So the biggest ask is Forest Grove Foundation, and they're down at 32%.
Oh, thank you, the numbers. Okay.
And the next is Fourth Dimension.
Okay. That's great. So now that I see this, the two that are, let's see, there's 3 that are 70% here.
Those are the ones offering SUD.
Okay. Look, we're doing so good. We already preserved the ones that were SUD. Look at us. Okay. And then 65.
Turn this one. How did that happen? That's going to push us back up.
What's happening?
And it's also the biggest ask for SUD, is Allied Health.
Okay.
Do I want to leave it as is?
Oh,
they're still getting 65%.
This was the question whether or not to put them in or take them out.
Yeah.
Yeah, take them out. Probably. Just seeing these numbers, it's already getting so low. Zeb, Amy, what do you think? Take them out?
I mean, it takes care of our SGD problem, and I mean, it helps with it anyway.
Yeah.
Keep them in, right? We're talking about Allied.
Yeah.
Yeah.
All right. So leave them in and then just proportionally reduct everybody else down to what we need to be to get there.
How much more do we have to reduce this again?
4 million.
I'm sorry, what was that?
4 million?
4 million more?
4.2 to be closer to the, yeah.
Okay. So I hate to be the bearer of bad news here, and I'm not trying to be a Debbie Downer, but I know that we wanted to prioritize people already in a burn. So we have these two up here, African Refugee Immigrant Organization and Allied. And if you look over here, that is a little 4.5 million for those two. that aren't even a part of the burn. And I know that we like them and everything, and they do good work. However, we need to make a cut, and you want to prioritize the existing burns. That looks to me like that might be the two people that we're going to have to cut.
I can hide that and we'll see what that looks like.
And then Zeb,
that gets you down to 1.3 million over.
Still?
And the thing is, I understand the logic, but we put Allied back in there because of the SUD service component. And unlike many organizations, African, it's gone. I can't read the African Refugee Immigrant Organization is actually a culturally specific organization helping a unique population. Now, I would, for me, I would rather look at agencies that are more capable to bill out to supplement their income than to take out African Refugee Immigrant Organization.
So
Now,
what about Sequoia taking their SUD out?
that's the thing, though. The SUDs, I mean, because there's such a lack of money in the SUD already, which is why we've been trying to kind of keep as much as the SUD as possible, because it's so imbalanced between SUD versus peer support versus the other categories.
What if, nope, that's not even going to matter. I was looking at, no, never mind. Oh, like, damn it. Yeah. I don't know. I mean, either way we go, who is this one? Sequoia. No. Okay, wait a minute. What is Northwest Instituto Latino? Never mind. That's another culturally specific. Their program costs are $4 million. That's why so high in program costs. Did you guys already discuss that? Probably. I'm sorry, I had a client that kept me late.
Yeah, I think for theirs, they just, again, a lot of people have done their program cost in a variety of ways because they weren't sure where to put like any administrative expense or like the lease on their buildings or just like any variety of non-literal direct service. Excuse me.
So did we only reduce them 38% though? Or did we reduce?
No, other way around. 62.
Okay, it's the other way. Okay.
Yeah. So they've taken one of the harder hits among the bunch.
And Forest Grove Foundation is the other one that's funded below 40% in this scenario. And Fourth Dimension.
Let's get Mark in on the conversation, followed by June.
Yeah, it seems like with so much of this kind of overall dollars being put into peer support, that there's some wiggle room in that category overall.
I don't want to speak for the OAC, but I would like to point out that in past conversations, they have opted to let each organization determine where to cut dollars, which services to cut them out of. Is that correct, OAC folks? Yeah.
Yeah, because the company knows the company the best. But, and here we are back to, we still got to get 4 million out of somewhere.
But, also one of our, mandates is to provide a fully spectrum, the continuum of care responsibly. So there's also that too.
What I'm looking at, look how many peer support There is. Look how much, right? There's a lot of, everybody's offering peer support, okay? And Washington County's a pretty big county. But what if we were to do some figures here, reductions here? Because look, I mean, 4 million, 5 million, 1 million, another million. There's a lot of high asks in that area. Now I get it. I love peers. Don't worry. I know and they got to have a rate of pay and all that, and they're very important. But I mean, I'm just wondering if that might be an area we might have to look at.
June?
Yeah, I have just a couple, like two very different suggestions. I think that honestly, we should just go with proposal 2C and let the OAC handle this portion. This is too difficult without having to cut like full programs. That would be like option number one at this point, because honestly, at this, I'm just looking at cutting programs, like looking at this. And if you were to cut programs, which ones to cut? And I would say that most of your housing and harm reduction services are not billable services. And so it would have to be assessment SED or peer support. And so I just really feel like we've hit a brick wall. That's just my opinion.
Go ahead, Morgan.
Yeah, I was gonna suggest something similar, really, which is just to take the two new ones off, get down to the allotment by another proportional reduction, even though that gets some people very low, yes. And then just take it to the OAC, which is rather similar than what was just said. But because I feel like at this point, our expertise has, we've sort of laid it all out and we're still going in circles. But I'm amenable to whatever y'all think is best. If anyone has strong feelings.
Go ahead, Zeb.
Yeah, I just think it for myself, cutting out those two programs basically seals their fate. Because when people are presented with something initially,
yeah,
they tend to stick with it.
That's true.
But I completely respect what you're saying. My thoughts are, we are looking at having to cut programs. But we can also have this conversation in the OAC, pass this on and have the conversation in the OAC with those two programs in, just be over. And that could be a compromise that we could do. I don't know what you think about that, Morgan.
Yeah. Can I ask a question? What if we looked at the peer support column there and we reduced everybody's ask by 20% there? Would that get us closer to the 4 million? I know you got it over here and I know it's overall, but we're going to have to take some reductions. And that seems to be the one that can take the hit and make it. If everybody was to say, okay, we're only going to be able to fund this percent of 80% of your peer support ask, and plus they've already got this hit, of course, but that's going to get everybody funded. So if we were to do that, can I just get a look at what that would do if you took that? Yeah, minus 20%.
And June has her hand up, and then Morgan.
Yeah, I see what you're saying, Amy. I just think that we're beyond that, right? Like people have already been reduced so much that if we reduce those people, mind you, some of these folks don't bill peer support. So like we have West Instituto, they're not billing their peer services. So if we reduce them even further, I just fear that it's going to get to a point where when OHA offers these folks a contract, they're going to be like, yeah, well, we can't do it with that money. You know what I mean? And so there is no solution at this point. That's why this is so frustrating.
I just think that we got to look at it and see what it looks like, because there are so many people, so many entities offering peer support we're gonna have to reduce it anyway somewhere. So I just kind of wanted to see what that number was. I'm not saying we have to do it. I just want to see what that looks like for us. Did you
I'm
write
working on it. I'm working on it. Excel's fighting me.
But just to
Can't work too
keep
hard.
like Amy's proposal in line with things we've done previously, it would be taking 20% of column F and subtracting that from column J, essentially.
Yeah, that's what I'm saying. Yeah.
Yeah.
And then, you know, they would still be allowed to do their own thing. But I
Right.
do think that looking at percentage of the total asks here might be a little more informative because like the previous comment about how like the bounds of peer support get squishy when you get up towards SUD or whatever because peer support casts such a wide net. What people are putting here for as their proposals for peer support can vary wildly, and some of it is billable and some of it, like the Instituto Latino, is not at all. And so when we're making those targeted reductions, it's really hard for us when we're making the blanket reductions to tell whether or not we're cutting from orgs that have like no alternative funding streams, cannot bill for Medicaid, and those which have peer services that are often supplemented by other funding streams. And so that's why I particularly like to look at the number that's the percent of their total request to sort of just get a feel for how much we've preserved. But
Jason's probably cringing in the background. That is definitely not right. Where did I go? Oh, I see why. Folks, this is going to take a minute because the issue is that these caps are not being applied, and that's why it's so much higher. And there is a way to do this. 1 second.
And is this our last county?
This is it. Yes, last county, last calculation, and the OAC meets in 45 minutes to discuss.
Yeah, I think we just need to move this forward as it is. If it's that, because we're not able to get that any, you know, we can talk about it in the OAC. Let's just
That would be much easier than.
let's do that. Let's just do that because this is because we just need to move it forward to the OAC guys and have the OAC do it. Council, I guess.
Hey, OHC Council, you know we're just handing it back to ourselves.
Yes, I do.
Kathy.
I am going to step out on a limb and make a motion. I motion to move forward proposal 2C, column N for Washington County.
Kathy makes a motion.
I'll second.
To approve, and Amy seconds. Proposition 2C on column N highlighted on your screen. Discussion.
I'm good with that.
Okay, Carly, let's do a vote and make sure we still have quorum.
We do. Amy, how do you vote?
Yes.
Keisha has a conflict. Morgan,
Yes.
Zeb,
Yes.
Abby,
Yes.
Ariana,
Yes.
Anaim,
Yes.
Dana,
Abstain?
Daniel,
Yes.
Danielle stepped out. Drew, Emily,
Yes.
Gregory,
Yes.
Greta, I think she stepped out. Hannah,
Yes.
John, Juliana,
Yes.
June,
Yes.
Kathy,
Yes.
Kylie,
Yes.
Kirsten, Liz,
Yes.
Mark,
Yes.
Maya,
Yes.
Nicole Corbin,
Abstain?
Nicole Egler,
Yes, with concerns about distribution of service area.
Rachel. I think
Yes.
oh, you are here. Sarah Adelhart,
Yes.
Sarah Hubner, Tammy,
Yes.
Tatiana, and Tim.
Yes.
And that passes with 22.
Don't go anywhere. Ariana, can you stop screen sharing for me, please?
Yes.
Thank you.
Maybe.
Maybe.
There we go.
I just want to give a big thank you. This is it. We're done. We don't need to do this again. Except for those of you I'll see at 1 o'clock. And I just really wanted to again say thank you. It has been quite a journey to do all 317 applications. I can't, I don't even think I have 317 pennies in my penny jar. That's a lot. So I just really want to thank everybody for leaning in so hard. And I, one, learned a lot about this process. And, you know, assuming all of the stars align, I'll be here in 4 more years when we do this all over again. And I look forward to making improvements and continuing to work together. So any other closing remarks before we say goodbye as a panel review?
Yeah, I just want to echo what you're saying. Thank you so much to everybody who reviewed applications. Thank you, everyone who showed up to these meetings, and thank you for everybody that presented, and for council for showing up here and doing this hard work, and Abby and Carly and everybody behind the scenes. Kathy, I'm mentioning a bunch of names, but thank you so much. This is an impossible task. So just thank you.
Yeah.
Thank you, everybody.
Ask
Sorry.
Oh, so no, it's just it was really impressive how much easier things got as we went along. Like it didn't like decay into dysfunction or drama because OHA was constantly back there just tweaking the behind the scenes things, starting to like predict what we were going to ask for and what we were going to want in a way that really got the rhythm just banging along. And if you would have asked me 10 days ago if we were going to finish right now on the 20th of February, I would have not put money on that.
1 day early.
Ooh.
Or early. Yeah, it's great. Thanks all. See you in 4 years.
All right. Text me if I need to join the meeting, but otherwise.
Okay, you got it. Thank you.